Hello, my name is Dr. Paige Robson, and I'm a physical therapist for physical therapy and balance centers at both the Gainesville and Chiefland locations. I'm presenting today on how pelvic health physical therapy can help your patients. So, who's a good candidate for pelvic health physical therapy? Well, any of your patients that say they're leaking urine or getting up several times in the middle of the night to go to the bathroom, that puts them at an increased risk of falls and earlier admission to nursing homes. So go ahead and send them over to pelvic health physical therapy so that maybe we can prevent a fall with them. Also, any individuals who report that they have some pelvic pain, or male individuals post-prostatectomy, or even postpartum mothers can benefit from pelvic health physical therapy. So consider anyone who comes to you with incontinence, pelvic organ prolapse, constipation, or general pelvic floor weakness. The pelvic health PT assessment includes a subjective review, an internal assessment with patient consent, as well as the surface EMG biofeedback assessment, looking at the pelvic floor isolated from the glute max and the external oblique. So for stress urinary incontinence, we focus mainly on strengthening the pelvic floor, teaching the patient how to do an appropriate Kegel. We can also use the neuromuscular electrical stimulation to assist the patient in performing a Kegel, especially if they're too weak to perform one voluntarily. We also see here the EMG biofeedback that helps to promote the muscle contraction without any co-contraction. And then for females specifically, we can use vaginal weights. On the other hand, PT for urge incontinence focuses more on behavior modification, so making sure they avoid bladder irritants or getting them on a bladder program. We do teach them the urge suppression techniques, which helps in the moment of having that really strong urge and trying to go to the bathroom. Then we follow up with pelvic floor strengthening techniques. With constipation, again, we look to behavior modifications such as dietary changes or teaching them about defecation posture, but we also implement the ILU abdominal massage to help promote the movement of stool through the intestines. For pelvic organ prolapse, we do a lot of the same strengthening techniques except in a gravity-assisted position. And then for diastasis recti, we instruct on exercises that promote the union of the rectus abdominis, as can be seen in the photo. For pelvic pain, a lot of times we use the internal myofascial release of the hypertonic muscles, but we also educate the patient on relaxation techniques as well as elevators just for a general coordination of the pelvic floor. Again, too, you'll see the surface EMG biofeedback, and instead of focusing on strengthening here, we focus on relaxation of the pelvic floor. And then finally, with women, we'll sometimes use the vaginal dilators, and that will just help reduce pain during gynecological exams as well as sexual intercourse. That concludes this presentation on how pelvic health physical therapy can help your patients, but please reach out to me if you have any further questions. I'd be happy to talk about how we can work together to improve your patient's quality of life. Thank you.